I've been a nurse in Baptist Hospital for about 20 years. I was having a lot of lower back pains, and also I was having severe pain on my left leg. They brought me to the ED. I mentioned to the emergency room doctor that my right shoulder has been getting numb for the past couple of months. And so the emergency room doctor said, let's do a full scan of your spine.
Kind of a surprise, I think, to everybody, including her, maybe especially her, was that there was a very large disc herniation between the third and the fourth vertebra. A herniated disc is when the shock absorber connective tissue part of the spine that is in between the bones starts to degrade, and it gets a little hole in the side of the covering, and a small piece of the soft inner substance comes out. So this is her third vertebra, this is her fourth vertebra, and this is the disc in between it, and a piece of it is pushing on the spinal cord. She was expecting to maybe hear something about what we could do for her back, and now I'm telling her, you have pressure on your spinal cord, and if you don't do something about it, then you're really at risk of losing your ability to use your hands, losing your ability to use your legs appropriately. The issue is that it's your spinal cord, and the spinal cord, especially up here in the neck, really controls everything.
I have thought that this numbness on my shoulder and my back pains are all muscular. I didn't even know that it had involved already my spine. The procedure that I recommended to Melanie was an anterior cervical discectomy infusion. And basically what that is it's coming in from the front of the neck, and then I take the disc out until I get down to the spinal cord where the disc is pressing on it, and I very, very gently peel that off of the spinal cord itself. And then where that space was, we just put a little plug, and then a small titanium plate goes between the C3 vertebra and the C4 vertebra, and I keep it in place with 2 little screws, and that's that. Recovery was very quick for me. Although I was still, because of my lower back problem, I was still not able to walk or do much. She had mechanical back pain, and that was pain that was isolated to her back itself, what we call axial back pain, and that was most affected by movement, specifically things like twisting, bending, turning, lifting. My surgery was kind of twofold. 1, to decompress the nerve root that was being pinched, and 2, to put screws and rods and a graft in to hold the spine in place and stop it from moving and causing back pain or causing instability. In no time, I was doing physical therapy and back on my feet. After the surgery, we went on a trip, and most of all, what I'm very happy about is I am back to my job at the bedside full-time. Basically, if you've had persistent back, leg, or arm pain that's been going on for more than a week or so and is not responding to your normal rest or ibuprofen or things like that, I think it's very, very reasonable to talk to your doctor about it. My experience with Dr. Whiting and the Miami Neuroscience Institute has been great. If I wouldn't have gone to see Dr. Whiting, I would probably be disabled, unable to work, unable to live the life that I want, do the job that I love, which is nursing, and enjoy my family.